Hey everybody, Luke Gordon here, and today we're talking about the top 3 exercises for SI joint pain. So that's sacro-iliac joint pain, which is typically the pain right along back here where your SI joints are. I'm not going to go into a ton of detail on this video on what the SI joint pain is or if you have it or not, because I've got some other videos that talk about that. And before watching this, you also might want to watch a video I just made about our 3-step approach to eliminating the pain. So today I just want to give you some helpful hints and tips at home. What I also want to say first, so before I get into it, is that if you look on YouTube or Google or things like that, there are a lot of videos and exercises you can do for SI joint pain. And one word of caution is that SI joint pain is one of the hardest things to treat on your own. So while I'm hoping these exercises help you out and you can do some basic stuff to kind of ease the pain, just understand that there's a lot of different things that can go wrong with your SI joints in terms of like rotations or slips or flares, and trying to just get exercises and generic advice online is hard to do. So again, I hope this helps you, but if you have questions, it's always a good idea to consult with your physical therapist or your doctor, whoever first, especially if the exercises don't help as much as you want them to. So that being said, of course, you're really ready for this video now, I'm sure. But anyways, SI joint pain, top 3 exercises. The first thing I'm going to show you is how to do something to help correct a rotation of your pelvis. One of the most common types of SI joint pains and rotations we see is the right side of your pelvis will rotate forward. So with this technique, what I'm going to show you is you're going to actually do an isometric squeeze to help rotate that right side that's forward, to help rotate it backwards again. So what you're going to do is you'll lay on your back, and you're going to bring your right knee up towards your chest. From there, grip it behind your thigh, pull your knee up towards you, and then what you're going to do is you're going to push your leg that way and pull your arms this way. So my leg is pushing out towards my feet, and my arms are pulling up towards me. This is a muscle energy technique we call where you're activating your hamstrings, and that's going to help pull this side of your pelvis backwards. So that's one there. So you're just going to push there. Typically I have people do about a 5-second hold and repeat a set of 10. One thing there, of course, is that if typically people who have the rotation, this feels really good. If it doesn't feel really good, it could be that you're actually rotated the other direction. So you're more than welcome to try switching legs on that one. So that's your first one, just an isometric contraction there to help pull that rotation of your pelvis backwards. The second one I want to show you then is a little bit different than that one, but we're still going to be following a similar guideline. So what you're going to do actually is you're going to lay on your back, and with this side of your pelvis, you're still going to be pushing this way, and on this side, you're going to be pushing up this way. So you're doing the exact opposite direction on both sides of your pelvis here. So with this one, you're pushing your leg out against your hand. With this one, you're actually pulling your leg up towards you and pushing it down. So all we've done with that one basically is we're still doing a rotational movement on that right side of your pelvis. On the left side, you're doing the exact opposite. So like I said with the first one, if it doesn't feel good going this direction, then switch and go that direction. A lot of times what you can do is that'll actually feel good going both directions because you're just opening up the pelvis and the SI joints a little bit. So it's not uncommon for you as you're doing some of these self-rotational techniques to hear like a clunk or a pop and feel it kind of shift. And so a lot of times that's your pelvis actually correcting itself, and that's a good thing. But like all things, if it feels good while you do it, it's typically helpful, and if it doesn't feel good, then move on to something different or try a different exercise. So those are the first 2 there. Oh, same guidelines on that second one, by the way. 5-second holds, about 10 reps or so. Okay, the third one I'm going to have you try out, since we're doing top 3, is if you have a belt at home, we're going to do another isometric type contraction where you're just pushing against resistance but not moving. And if you don't, I'll show you with an exercise band instead, because these are a little more common. So same position as the other 2. You're just going to put the belt around your knees, just above your knees, right about here. You're going to lay down on your back here, tuck your pelvis back, kind of engage your abdominal muscles there, and then you're going to push out into that belt. Hopefully the belt will stay. So you're going to push out into that belt. And again, you're going to fire some muscles up in your hips that are good for you to strengthen anyways to stabilize your pelvis. But a lot of times on these ones, you will feel like a little pop or a shift in your pubic bones there. So about a 5 to 10 second isometric. Don't try to kill the belt or the exercise band. Just do about a 50% contraction there. 10 reps again. One more wrinkle on that one is that if you take the belt off, you can also just squeeze a hand or 2 or like a little ball in there, and that'll also just open up your pelvis and space it. So with those 3 exercises, actually, Same idea with the band. So if you had a band instead of the belt, just put it around your knees, engage your core, and then go outwards like that. About a set of 20 or so, and do 2 sets of those. So let me hop back up here. Probably got red in the face by now. Not as healthy as I look sometimes. But so with all 3 of those, basically you're just looking for ways to realign your pelvis and open up some space. And even though there's somewhat generic exercises, a lot of times those will help, because just by putting some force on your pelvis and encouraging it to move a little bit, it'll actually move in the correct direction. And you'll know if it works. A lot of times it'll feel better instantly. So those should be helpful for you. And again, just to come full circle, sometimes it's hard to treat your own SI joint pain because, again, you don't quite know if it's rotated or flared or slipped or where it's quite at. So if these help, that's great. They're a good starting place. And if you have any more questions or want to know more about what causes your SI joint pain, either leave a comment below in the video and I'll get back to you, or my personal contact information is down in the notes section below too. So there you go for today. Thank you for watching.